So I will be doing my presentation over breastfeeding as a public health issue. When I first started thinking about what topics to do, I was going through a list and then I saw breastfeeding and I was confused as to how that was a public health issue. And I was thinking like, isn't that more about the individual or the father and the baby and things like that? But then so I did some more research and so according to Wiley Online Library, they took a bunch of studies from PubMed, Web of Science, and Science Direct, and they combined all of the themes to make the claim that breastfeeding is a public health issue on a more than individual level, and it's more on a societal level. So these 5 components here: health services, population level health promotion, supporting maternal legal rights, protecting of maternal well-being, and reducing the reach of the breast milk substitute industry. Those are all the 5 most important components that make breastfeeding a public health issue, with the combined things from all of those studies from those websites. And also Pediatrics, they're a journal, and so they did another research study where they found that breastfeeding could save up to 900 lives and billions of dollars if 90% of women breastfed exclusively for the 6-month recommendation period, which is right after childbirth. Also, they found that $13 billion in estimated losses due to low breastfeeding rate includes calculations based on lost potential lifetime wages, which equaled out to $10.56 million per death. So that's pretty much how breastfeeding is a public health issue, and that's how it affects more than just the individual and the child and things like that. So the computer froze. So yeah, give me a second. All right, so next I did some history and to talk about how breastfeeding started and how it used to go about before, we had all this technology and this formula and things like that. So wet nursing was a popular topic. It's when a woman breastfeeds another woman's child. So it's not like we know today breastfeeding where, the mother is breastfeeding her own child. It's where she pretty much gives her child to someone else to let her breastfeed them. So starting in 2000 BC, Israel, they started breastfeeding as a religious obligation. They saw the baby as a blessing, so breastfeeding was pretty much a religious obligation. And something else that was pretty popular was lactation failure, which is when pretty much women can't breastfeed. And then we go to 950 BC in Greece. These wet nurses, they developed a higher status than slaves, so they became more important and got way better treatment than slaves. At a point in time, they were pretty much this equal. And so then I have pretty much the most important part. So in 17th century France, the mother started nursing their own child, and that's when that became more popular. And then in 1900, the pretty much whole organized business of wet nursing, that became extinct. And that's when, mothers pretty much started nursing their own children more openly and popularly. And then we have the feeding bottle. So the cow horn, which is shown here in this picture, it's the most common feeding tool. And so then in 1851 France, the first bottle with a cork nipple was invented, and it had a bunch of ivory pins through so it could, filter through the bottle. And then in the beginning of the 21st century, that's when we got the refined rubber nipples, so the baby could suck on it, it could emulate, more of a actual nipple. Then we have infant formula. So this also started back in 2000 BC when people started using animals' milk to feed their infants instead of the actual lactation. So also something important. So in 1930 through 1940, John Meyerlings he created evaporated milk, and so those evaporated milk and like non-milk substitutes were popular at that time because you had children who were allergic to milk and things like that. So he created evaporated milk, and it became highly recommended by doctors and pediatricians and things like that. And so then, in like 10 years later, physicians and consumers validated formula as popular and a safe substitute. And so pretty much this is when formula became the most popular, and breastfeeding, became became on the back burner of things. So some cool rates and like kind of fun facts, I guess. Only 1 in 4 infants is exclusively breastfed as recommended by the time they are 6 months. So the recommendations for breastfeeding is to be exclusively breastfed for 6 months, and then you start weaning after that 6 months and start incorporating solid foods and things like that, but still breastfeeding so the child gets the absolute maximum potential of nutrients and things like that. So only 1 in 4 infants go through the exclusive 6-month period. Low rates of breastfeeding add more than $3 billion a year to medical costs for the mother and child. So that's a huge amount of money. So when thinking about if you want to breastfeed or if you don't, you should always take this into account. Also, black infants are 21% less likely to have ever been breastfed than white infants. I found that pretty interesting, and I was trying to think of like the reasons why, and I was thinking it would probably be because of like the time commitment, and like white infants usually have more affluent parents, and so they have more time to breastfeed and do things like that. So that's what I just thought, but I have no idea why. So there's a chart here. So the U.S. national average for children ever breastfed was 83.2%, which is really good because our national recommendation is to get to 75%. So breastfeeding at 6 months was 57.6. That's the number that we're trying to get to 75%. So this is ever breastfed. That's initially, but not for the 6 months. Some other cool, I guess, topics on this chart. Exclusive breastfeeding through 6 months is 24.9. We're also trying to get that to 75% as well. And then I included Iowa in here. So ever breastfed, 81.5. Breastfeeding at 6 months, 51.4. Exclusively breastfeeding through 6 months, 29.5. That's higher than the U.S. national average, but it's still, not where we need to be. So yeah. Then we have benefits for the mother and child. So on the right, we have here the benefits for the mother. So a lower risk of breast and ovarian cancer, helps lose pregnancy weight. So I found that when you breastfeed, you also burn 300 to 500 calories per day that you breastfeed. Lower risk of osteoporosis, so the body absorbs calcium better to put into the bones and things like that. Then you have heals body after delivery. So when you breastfeed, you release oxytocin, and that in turn like lowers your rate of post delivery bleeding, and it also lowers your it causes the vagina to contract a lot, and it allows the uterus to go back to normal size. Delays menstruation. So when you release prolactin, which is the protein that helps women breastfeed, estrogen and things like that, that is pretty much put by the wayside because prolactin is at the forefront, so it kind of delays your menstruation. You get to bond with your child. I feel like that's huge, and that's when you get the actual relationship with your child, and you get to incorporate like talking to them and noises, and you get a relationship with them. It also saves a lot of money, and parents have up to 6 times less absenteeism from work. So I think these two are huge because you have to buy formula all the time, but breastfeeding is free. And also because it's so healthy for the child, you never have to you have a 6 times less absenteeism from work because you never have to call off to take your child to the doctor and things like that. Also for the child, it causes less stomach upset, diarrhea, and constipation. Lessens the risk of SIDS, which is sudden infant death syndrome. That's when the child pretty much randomly just dies. it makes vaccines more effective. I thought that was important because we have been talking about vaccines and what are the causes of that and things like that. So the antibodies in the breast milk actually coincide with the vaccines, and it allows for it to flow through the body and work better. And this is a big one. It reduces the risk of viruses, urinary tract infections, inflammatory bowel disease, gastroenteritis, ear infections, and respiratory infections. So pretty much it reduces the risk of all the common illnesses and things that would, pretty much have a parent leave work, and so take them to the doctor. So also obesity is a big public health issue, so I decided to, include breastfeeding and obesity and the link that they have here. So breast milk is easily digestible and nutritious, and the child also is able to choose when to eat it and how much. And so that's big because as you grow up, it provides healthy eating habits, and it provides it at a young age. So that's how you gain those habits as you grow older. And this is from Women, Infants, and Children. So the percent of children obese at age 4, when they had only breast milk, it's 19.8%. Some breast milk and some formula, 24.2%, and only formula is 24.9%. And that is a huge jump from the 19.8% for children who are only breastfed. Also, researchers in Okayama University in Japan reported that 43,300 Japanese children were less likely to be overweight or obese at ages 7 or 8 compared to the kids who drank formula, and those are the kids who were breastfed for the recommended 6 months. Also, another public health issue, postpartum depression, and so I include the link between breastfeeding and postpartum depression. So, a study done on, I think, obstetricians and gynecology. So early breastfeeding experiences and postpartum depressions in 2011. So a study of 2,586 women were pretty much surveyed, and 223, so 8.6% of them had postpartum depression from breastfeeding. Well, not necessarily from breastfeeding, but who breastfed at 2 months. So what they found was that women who went through negative experiences rather than they didn't like it or it was painful, those were the women who were depressed postpartum, pretty much. So the future of breastfeeding, the national goal is 75%, like I mentioned. Low breastfeeding rates of 59% in the United States that we saw on the chart continue to be evident despite, the widespread information that we give. So I think that's contradictory because, this was from one of the CDC website, and they said they give a lot of information. But then I researched and I found a study, and it was on the major factors influencing breastfeeding rates. And so 28 simple questions were asked to 245 mothers, and the initial rate was 44.3%, and by the time the infant was 6 months, it was 13%, and that's just a huge drop off. And then you'll see on this chart that right here, 95.4% of those mothers that were surveyed wanted more information from parental class on breastfeeding, and that would influence, whether they wanted to breastfeed or not. So this was just a cool chart, and another high percentage was more information from magazines, books, and TVs. So you see how the CDC said that they give countless information, but here you see women still want more information. So breastfeeding in Cedar Rapids. So the Mercy Medical Center has breastfeeding support, and they meet every Wednesday from 10:30 to noon, and it's free. St. Luke's also has the same thing, and they meet every Tuesday. Also in Cedar Rapids, we have this thing called Live, Love, and Latch. So it's during World Breastfeeding Month, which is in August. This year was August 18th. And so it was down at Daniels Park, and they, went out, and it was just a huge picnic and support system group, which is very important when breastfeeding, especially for such a long period of time. So it was just a big support group, and all mothers who wanted to breastfeed or who were breastfeeding, would go down there and meet up and talk and relate to each other. It provides a good sense of community and support and things like that. So I have this video that pretty much shows how to breastfeed for, you know, anyone thinking about it or thinking about the process or anything like that.
Rest with your nipple aligned with her nose. If she's not opening her mouth very wide, tap the nipple on her mouth to get her to root. You can try a U-hold around the middle of your breast to make this easier. The top of your nipple should be far enough in to reach the soft palate at the top and back of her mouth. Once she starts to suck, check to see that the top and bottom lips are flared out, not tucked in, and that they nearly entirely cover the areola or dark skin around your nipple. You can also listen to hear if she is swallowing milk. It doesn't look like sucking from a straw or even a baby drinking from a bottle. You may wonder, how can she breathe? Her nostrils are squished. Don't worry, your baby will pull away if they aren't getting air, and their little noses are squishy, so that they can drink and breathe at the same time. Try not to pull your skin away from your baby's mouth to clear her nose. It will disrupt the solid latch she has on your nipple and cause discomfort in the long run. The sensation should be like mild tugging. It should not be acutely painful, but your nipples will be tender in the early days. If you can see that the latch is not deep and secure, or if it really hurts, insert your pinky and detach the baby and try again. Letting her nurse with a bad latch can cause blistering and other damage to your nipples. A cream that contains lanolin can really help this pain too.
So yeah, I felt that was pretty important, especially for, you know, all the women who said they don't have enough information. I feel like that video and things should be like, things like that should be, you know, pretty much widespread so that people do know how to do it and what they go through and the proper mechanics and things like that. And those are my sources.